So we're going to address this theme, is water a drug? We have Gerard Friedlander, Monique Roman, and Jean-Noël Flézaquier, who was supposed to manage the debate, but he had to have an operation. He is stuck in Tours, so I'll be replacing him moderating this debate. And Jean-Louis Chaussade also was a victim to the Air France strike. And so he will be joining us via a video connection for the debate. So we're going to start by asking the question, is water a drug? I'd like to know what Gerard Friedlander thinks of this. I remember the heat wave of 2003 in France, where the elderly in France were dying of dehydration. 13,000 elderly people died. What did we see in 2004? We saw giant people, the elderly were drinking too much water, and they were almost alcoholics because their families kept forcing them to drink water. So what do you think? Well, water would be a strange drug because it has no price or a variable price. It's good or less good in terms of quality. And I think Mr. Chaussade will say more about this. And indeed, just like any drug, the underdosing can be harmful, and overdosing can also be very dangerous. Now, what do we mean by, is water a drug? Well, I'm a nephrologist by training, and so I've been living with water since I was a young boy. Let me give you some examples to set the scene, examples that some of you know. For some of the unhappy people here, unlucky people who have had nephritic colitis, and they know how painful that can be. Urinary lithiasis. The first recommendation that's given is that they should drink more water, and when you travel, drink more water. So, is it truly a drug? Not really. It's certainly a preventive measure. And for urinary infections, it's the same thing. I'm just trying to please you as the urologist by giving these examples. Of course, water is a prevention measure to prevent relapse, and it is a very useful measure. And let's remain with urology here to give you the example of bladder cancer, which something that people are not so aware of as they are with bronchitis, bronchial cancer, is that tobacco is a significant element of risk for bladder cancer. And we know that if tobacco encourages bladder cancer, it is because inhaled substances pass into the blood. These substances are carcinogenic. They are eliminated through the urinary tract. They're stored in the urine in the bladder. They interact with the cells of the bladder, and they end up in creating mutations. The more often you empty your bladder, the more your urine is diluted, the less these substances will be toxic, and that's obvious. So everyone is going to leave the room immediately and start drinking water. And certain literature has emerged in two areas more recently. Chronic kidney disease, which is truly a disease that weighs very heavily in terms of discomfort for the patients, but also in terms of financial burden for society, because 30 to 40,000 patients have terminal kidney failure in France, and over 2% of the health expenditures, that represents only 2%, over 2% of the expenditure, but there are probably 10 to 50% more than these numbers. Today, we know that depending on the amount of water, we can slow down the inevitable progression of kidney disease before its ultimate stage. And here we are really dealing with a drug, in a sense. It's a substance that can modify the course of a disease. Now, chronic kidney disease is frequent, but there's also a genetic disease called renal polycystosis, and we know that the hormone that controls the water balance in the organism, called the antidiuretic hormone, is toxic in this disease, to such an extent that they have manufactured antagonists, pharmacological antagonists, for hormone receptors. But we haven't been able to manufacture the right antagonist with respect to all the receptors. So there's several ways to slow down the secretion of this hormone, and one is to drink water. I'm waiting for an industrialist or a company that will have the courage to financially support a study concerning this disease, which shows that if you increase water intake, you can stabilize again the evolution of the disease. Then we can talk about other things that are much more frequent. Water and salt, we know, have links that are complicated. The role of this antidiuretic hormone in blood pressure has begun to be proven. A certain number of studies have been published recently, so we're going way beyond here just the small circle of kidney disease. And I will make one last comment before I end. I'd like to share an observation that's been published with you that's even more provocative. You know that recently, about 10 years ago, a hormone was discovered that was called Cloto. Cloto, named after one of the parks and if this hormone is lacking, it's manufactured by the kidney. We know now that we have a phenomenon of accelerated aging. Animals that don't have Cloto age more quickly than others, and the same in human beings. And so the recent discovery is that this hormone, antidiuretic hormone, that will decrease the manufacture of Cloto by the organism. So today the question is water and the quantity of water that we drink, can it influence longevity? We need some studies, and these studies are lacking today, but we do have some avenues to explore that are very interesting. And we still need to study this link of cause to effect with humans. Jean-Louis, thank you for being here. I'm sorry that you can't be with us live because of this very frustrating transport strike, but we're very happy that you're connected. You're passionate about water. H2O, one oxygen and two hydrogens. It's very simple. Well, it's nature that produces it. It's extremely
good for the planet.
Good for the planet. We consider that about 95% of the water that we consume is salt water that exists, and the 5 remaining percent, there are about 3% that are concentrated in the poles. So we have very little water available to us, fresh water. If you allow me to come back to the previous debate, it was very interesting for the neophyte that I am. I'm not a doctor. With respect to that question, can water accelerate or increase life expectancy or slow down aging or slow down the conditions that arrive at the end of our life? We should place this in the context of the 19th century. Actually, water was a factor of life, and very often it was a factor of death at the time. In a very persistent way, even today, in many countries that don't have the type of systems that we have for proper water distribution. I think it's clear that it's one of the miracles of the Industrial Revolution of the 19th century. Is that thanks to Pasteur and those who analyzed what was contained in water, that we understood that water was the first vehicle of these great diseases and great epidemics of the 19th century. In our memory, sometimes we've forgotten this, but in Paris, Barcelona, they had terrible epidemics due to water up to the 1890s, the 1870s and 80s. So water for many years was a factor of disease. I don't think people realize in our countries, in our modern countries, the fabulous progress that has been achieved over the past 100 years. If I can give you some figures to reassure those who may think that drinking water in France is not drinkable, it's certainly the product that today is the most strictly controlled, and it's a health product. When you ask the question, is it a drug? I don't know, but it's certainly a health product. There are about 10 million water analyses carried out in France every year, and we verify 54 parameters constantly to make sure that the water that arrives at your tap and my tap is of good quality and doesn't carry any diseases that would be harmful to our health. So water seems to be something quite simple, but it's absolutely something that's magnificent. That, as I said, it can carry death, it can carry life. And it's an unbelievable product. It's exceptional. And I'd like to add that luckily there's not only water in the water that we drink. And the doctors here will agree with me. I think it would be a catastrophe because we also need salts, mineral salts, for the human body. Well, that's very interesting because in terms of safety, you talked about a huge amount of controls. I have the impression that you control much more than what we do in the operating theater. I'm a surgeon. We don't have so many controls per day. I visited the Gervita Danone plant, and you carried out 1,000 controls per day there. And you said you have a lot of constraints. That's a question that I'm interested in. How can you bring out drinking water in a city like Chongqing in China with 32 million inhabitants? You're supplying water there. How did you reach this success in the framework of a concession? You told me that you had the freedom in this public service concession, freedom to work, and we would love to see that in our hospitals, our public hospitals, to produce our health care. So you had the freedom to deal with the safety in the concession. Now, safety, I would say it's consubstantial to a society such as Suez that I work for. We and our ancestor, Lyonnaise des Eaux, was born in 1881, and the company was born to supply drinking water of two qualities to inhabitants near Nice, because it was actually the water supply to Cannes. So, as I explained earlier, the Industrial Revolution took place, and then Pasteur was doing his research, and there was a huge fear that water was carrying poison as it supplied the cities. So in our companies, in our DNA, the problem of water quality is something that is absolutely a core preoccupation, even for all the people working in our company. So yes, the quality is an essential element, and even more so if water is not of good quality, it can create significant problems for human health. And when we build large plants supplying 500,000 people with drinking water, 1 million or several million, as you said, in Chongqing, we cannot allow ourselves to have water that is not of excellent quality. Excellent quality in our lingo means that it's a water that is compliant with the WHO regulations. And that's why rapidly earlier I talked about the 54 thresholds or parameters that must be complied with. There's no company, water distribution company, that does not apply this idea that the quality is the first, water quality is the first service that it can provide to its fellow citizens, whether they are customers or subscribers. Now, as for the concession and the delegation of public service that we work with, this is the French model. It's the Suez Canal model. In 1870, the French invented this type of management whereby the public authority keeps the decision-making authority, the controlling authority, and the power to decide the long-term policy for the concession in terms of investments, the objective, the quality of water, the flow rate. And then once these objectives have been set, and we set the price, which is also set by the public authority according to the obligations that it asks the concession holder to provide. And then the concession holder acts like a private company. They respect a certain number of standards, but they also try to provide the service required at the best possible cost. And this is why when you look at the price of water in Europe, we see that France is extremely well positioned with an average water price and sewage treatment at around 3.3, 3.4 euros, and the European average is at 3.5. But the Nordic countries that are very well equipped, Germany, Belgium, Holland, and England, have water prices that are much higher than the French prices. So I think this system has allowed us to combine two things that appeared contradictory: the authority of the public power in terms of water quality and the capacity of companies to mobilize through innovation and intelligence to improve things and to be able to provide the service at a lower cost while still complying with extremely precise specifications. So initiative and innovation are at the core of our business, and that's why we've succeeded in France, and that's why we also succeed very well internationally.
I have another question for you. We know that the Earth is not going to have enough water. We need 3 tons of water to produce a kilo of steak, and the emerging countries are moving towards a carnivorous food routine. What is your vision? Well, there are a certain number of truths that we can't escape. The first truth is that the quantity of water available on the planet, so the water available, is more or less constant. And as the population is going up, it's going to be going up by a little less than 1 billion in the next 150 years. So we can see that the quantity of water available per inhabitant is going to go down. But it's going to go down by 15,000 cubic meters of available resources per inhabitant to something that's 3,000. So these are figures, of course, but we know that when we're looking at 1,800, we're in a drought period, and below 1,000, where we can talk about water pressure, a real lack or shortage of water. And we know that water is not very well shared across the planet as well. So when we're at 9 billion, when the population is at 9 billion, if we don't have optimal management of water, we're going to have real water problems. And when we talk about global warming, the first alarm is going to go off in places that suffer from water shortages. And these two figures are from China. China represents 23% of the world population, but it only has 80% of the water resources, and the resources are not homogeneous across the entire Chinese area. So you gave a very good example. We need, for 1 kilo of meat, we need something like 10,000 liters of water, cubic meters, that is. One thing is sure, anyway. There are 3 subjects that we're going to have to think about, 4 subjects, so that we can manage water better. The first subject is that we have to look at water use. We have to manage water use. We're not managing that today. Nobody's wondering what industry consumes in terms of water, or what about agriculture. And in reality, when you look at the figures, it's agriculture that uses the most. 75% of water across the planet is used by agriculture. Industry accounts for, according to the country, 15 to 20% maximum. And then you have a human consumption that probably represents 5 to 10% of water consumption. So we're going to have to manage that, the needs of the population, the needs of industry, and the needs of agriculture. That's the first challenge facing us. And it brings us close to the question that you're raising, is will everybody be able to eat as much meat as the Americans in the future? The answer is going to be no, absolutely not. That's for sure. So then we're going to have to manage different water cycles. Today, in countries that are very thirsty, where there are water shortages, water cycle management has not been optimized. Far from that. What does it mean to optimize the water cycles? Well, you need to understand the resource that you have available. You need to make sure that it is of good quality. Then if you distribute that water, you've got to make sure that there are no monstrous losses through the distribution network. So most cities have a yield, in other words, the quantity of water that goes to our houses in relation to the production, that is something like 50–60%. So we're not going to be able to keep to that level when we're in a world that is lacking water. So we need to look at smart management of water. We need to manage that water. Shouldn't we take showers instead of baths, for example? How much water do we consume when we're washing a car? We know that in our day-to-day life, we could consume less water than we actually consume. A country like France doesn't have a water shortage, but we could continue to lower our consumption, something like 20% a year. And we don't feel that we are lacking water in France. At the end of the cycle, you recover residual water, and what we're seeing now are short circuits. The water is treated, and then it can be reused for agriculture or for industrial applications, depending on local needs. And then finally, of course, there is the ability to produce water alternatively. You know, how do you remove salt from water, from seawater? There are techniques that are highly sophisticated. We could build factories in order to do this. Think of Australia, for example. Perth, just to give you an example, has to have this kind of technology in order to remove salt from water, and these techniques are getting better every day. So the idea is to reduce the consumption of energy as far as possible in these technologies. So there are societal solutions, there are technological solutions, and then there are human solutions to this water question. The most complicated thing is the question of exodus. When there's no more water, people leave. There's no more agriculture. This is the case in the Sahel region in Africa. So this is something that has to be anticipated. This is what the Chinese are doing increasingly. Thank you. So we've had the physiologist with Gérard Frilandet. You've told us about some very interesting things from an industrial point of view. Now let's move to Monique Roman, who is a professor at the University of Lille 2 and who is in charge of the French Nutrition Society. Monique, what advice can you give us about water? Well, I'm going to come back to today's subject, and that is the subject of inequalities, because effectively it is a great choice of subject, water and drinks in general, in terms of inequality. We've just heard about the issues. Access to water is a major inequality. He talked about epidemics in the 19th century in Paris and London. But we mustn't forget that currently, even today, 11% of the world population does not have access to drinking water. There are 500,000 children who die every year from diarrhea because they've been drinking water that was not potable. So there's a high level of morbidity linked to malaria and other diseases carried by water of bad quality. So that's the first inequality. And it's a major inequality in terms of health. It's something that doesn't affect us anymore, but it's something that is still out there in the world. And now, thanks to a number of initiatives, you talked about China, and what Suez is doing. There are many actions being carried out to improve the water situation, but at the same time, we talked about climate change, global warming. On the one hand, you've got the problem of drought, and on the other hand, you've got the problem of flooding. And that is going to have consequences on the quality of water and consequences for health. And then there's pollution, water pollution in some countries, notably in South America, pollution by pesticides, immoderate use, considerable use of pesticides. So I think it's a good idea to talk about our necessity to save water in all countries and think about what's happening everywhere in the world. It seems to be far into the future, but we mustn't forget that the wars in the Middle East are often gravitate around water. Water, at least, takes up part of the conflict. So inequality can be linked to water. Water can be of good. The quality of water is important, and then there is this issue of drink. Let me just remind you that the consumption of sugar-containing drinks, and there's no doubt about this, the increase in the consumption of this kind of drink encourages people to gain weight. It increases obesity in children. So again, this takes us back to the idea of a social inequality, because it's in the most underprivileged populations that we have the highest level of child obesity. Child obesity is a great indicator of social inequalities. When you look at neighborhoods where you have a high prevalence of child obesity, you've got all of the indicators for social inequality in those neighborhoods. In my region, there are cities, towns where there is a percentage that is very high. 25% of children are obese. Now, that's where you have the highest consumption levels in terms of sugary drinks, because sodas, like junk food, are the only possibility for these populations in terms of access to consumer goods. Parents who sometimes feel that they're not giving everything to their children that they would like to give, at least they can give them sodas, sugary drinks, and they would feel that they would be depriving them of a consumer good if they didn't do this. So they want to try and do something for their children, and it's negative. And that's important, this phenomenon of what the sugary drink represents. Now, the United States are seeing the rate of obesity going down because of prevention campaigns. Well, yes, that is true in the United States. But when we carried out tests and we replaced a can of soda by a can of drink with added sweetener, and we carried out this test on obese children, we can help to reduce the weight of these children. Other actions have shown that if we promote the consumption of water and we make water fountains available, once again, it's possible to encourage a drop in weight. We mustn't forget that obesity is something that has multiple causes, and many measures are related to it, but many measures can be used to reduce obesity. So making sure that children have access to good quality water, making sure that they learn to like drinking water, because, you know, the mothers drink these sodas as well. So that's important. These are the preventive measures that we need to focus on. We've talked a lot about inequality of access to healthcare, but we haven't talked very much about prevention, and that's important too. Are you still with us? Yes. I just wanted to have your opinion. We're seeing industrialists in countries selling their drinks in... What can you tell us about what they're doing in these countries where there isn't even clean water? Well, I'd just like to come back to the problem of obesity first, if that's okay. Obesity, I'm sorry, the sound was cut off. I'm sorry, we're having problems with the sound. Can you hear me? So in Mexico, a bottle of Coca-Cola is less costly than a bottle of water. And so the consequence of this is huge obesity in children. The Mexican government had to subsidize, had to find the means of reducing the price of bottled water. So usually these are big bottles of water in order to fight against the problems of obesity. Now, these questions in relation to water quality and drinking means, these are subjects that are universal. Why doesn't everybody build plants for making potable water rather than getting their populations to drink water from big bottles? There are several answers to this question. And this is a problem we've had to face with all our big concessions in different countries. First of all, people who don't have access to potable water are generally the poorest members of the population. If you look at the centers of cities across the planet, they have drinking water. So basically, the relationship between drinking water and bottled water goes from 1 to 20,000. So that really does explain that the centers of cities have access to water, but the surroundings of cities have to pay for water that is very expensive, and therefore the people living in these peripheral areas tend to buy fizzy drinks. Why don't we build water treatment plants more often? Well, because it's highly costly and complex. In France, we've forgotten this, but the city of Paris started to build these plants in the 1860s. It took us 150 years to really have a water treatment system that was stabilized and produced good quality water. So, over that period, we laid a million kilometers of pipes for water. So very often, the problem of water concerns underprivileged populations. And so, water is really one of the big development problems for governments in these countries. So it's important to invest massively. We have to help these countries, and that supposes having the right kind of governance as well, and that's not the case in all countries. Thank you. Stay with us, Gérard. Yes, I just want to come back to the last things that have been said and maybe underline those. I want to talk to you about experiments carried out in schools in Germany. You mentioned these, or the Netherlands, where water fountains were made available in classrooms. It wasn't just making available big bottles of water and allowing children to go and help themselves to water. There was a whole educational environment that went hand in hand with that in order to raise children's awareness of the question of water. A bit like Mr. Chaussade mentioned, why is water a precious resource? Why do we have to be careful in terms of the quality of water? In other words, they had to build up a water culture. They wanted to build up a water culture. Water had to be, they decided, part of their education. We teach children to eat properly. We teach them to have good manners at table. But it's also important to teach them to drink water and to teach them about the importance of water. And it's also important for adults to behave differently. I think there are very big educational challenges here. Society needs to take these on board. There are health challenges relating to water. There's the question of obesity, the challenge of obesity, but there are others as well. Let me just remind you that studies are coming out on a regular basis concerning the importance of drinking water on sports performance, for example. Now, nobody's surprised about that, of course. You just have to look at Roland Garros, the tennis tournament every year, and see how much the tennis players drink. They don't drink that much. No, they drink relatively little, but then there's the question of how should you be drinking water when you're running a marathon, for example. But it does concern only a minority in terms of the population overall. Dehydration, sorry, a lack of hydration has serious consequences on cognitive performance, on learning ability. And again, this concerns children. So we're looking at things from a very broad point of view. You've got the qualitative aspects, the quantitative aspects, with the luxury of having these as concerns, but as a population that doesn't suffer from a water shortage. Yes, Monique. Yes, I'd like to dampen your enthusiasm about hydration. The studies in terms of cognitive performance among children, many of these have been carried out. It's true that children have to drink enough water, but very often these were carried out, and I remember several of them. Many of these were carried out in very hot countries, in Israel, for example, and so there the environment is different. And we've got to be careful because I see many obese patients who drink in order to eliminate, because that's what the advert says, drink and eliminate, and so they drink a lot of water. So they drink a lot of water, but they don't eliminate as much as that because they don't have time, they're working, so they let their bladder fill up. And at the end of the day, these women who are sometimes young, they come along and see us, maybe you've seen some of them, and they suffer from incontinence because they drink a lot in order to eliminate fat. They don't eliminate that much fat, and basically they expand their bladder. So it's important to be careful. I'm not saying we shouldn't drink, but we shouldn't drink excessively. When we see young women with their bottles of water, chugging it down all day long, yes, and then of course there's the problem of waste, water bottles. Anyway, perhaps we could make water from plastic waste. Anyway, we're talking about useless expenditure for the body, for society. So don't drink too much either. Anyway. Okay. I think that it's this idea. Well, it's it's like having a wrong good idea or a good wrong idea. Nature has done things well. We are perfect beings. We have been created as we are. And in our hard disk, there is something called thirst. And if we drink, it's because we're thirsty. Or it's rather when we're thirsty that we should be drinking. But I think that this apologia of common sense does have limits. In many other behaviors that we have, in many other attitudes that we have in terms of prevention, we don't respect this kind of natural mechanism. And I have to say that for decades, the thirst triggering threshold, we thought it was the same for everybody, but in fact it's highly variable from one human being to another. The way the body triggers the secretion of its hormone that controls water, it's the antidiuretic hormone. That's what controls thirst. It's something that is highly variable from one human being to another. In other words, like many different behaviors, we can't trust it in terms of, well, if we're not thirsty, it means that we don't need water. I think that's just not true. It's just not true. And the diet advice that we give in the case of medical conditions and also from a prevention point of view is not to wait to be thirsty to drink water. We're talking about water. And when we look at the multiple effects of this hormone, we're convinced of this. Let me just open a parenthesis here. It's interesting, I think, in terms of dialectics. There's a vitamin that everybody knows today, and that is vitamin D. Vitamin D, it's the vitamin that you have when you're not very strong. And then, over the last 20 years, we've realized that vitamin D had cardiovascular effects, that a shortage of vitamin D is associated with certain cancers, that vitamin D controls immunity. And all of a sudden, vitamin D came out of the cupboard, if you like. And so the antidiuretic hormone is doing that now. And I think it's important because the simplest and most economic and most efficient way of leaving the hormone at reasonably low rates is not to manufacture some kind of competitive inhibitor of the receptor or whatever it is. The thing to do is to drink water.
So from time to time, our common sense and our trust in our universal hard drive is something that really needs challenging. Well, yes, it's true that you get used to drinking water, and sometimes you see you get used to these aquaholics. And it's incredible to see these elderly patients having to get out of bed 4 times a night. They're becoming aquaholics, and they drink as much as 3 or 4 liters. Well, that's a true issue, but the tolerance to water depends on what you eat. If you have a healthy diet and a balanced diet, you're resistant. That means that you're in a situation of homeostasis if you drink 4, 5, or 6 liters of water. But on the other hand, if you combine large inputs of water with bad nutrition and your kidneys aren't working properly, then you're going to have complications such as hyponatremia. And in the elderly, and that's why they are a risk population, and the advice has to be individualized. You've got all 3. Their kidneys aren't working very well. Very often their nutritional input is modest, and you say to them, well, you may be dehydrated, so you need to drink, and that's where it goes wrong. Well, I think we should say drink when you're thirsty, and eat when you're hungry, because obesity is due to the fact that very often we eat all the time and not necessarily when we're hungry. So that is something that we've got to get back to. We've got to get back to our internal signals and learn to tell children to listen to their internal signals of hunger and thirst. It's important. And 3 to 4 liters or even 5 liters a day is not going to do them any harm. But that's only if they have a varied diet, and they have, if you do have a varied diet, you've got water in the food you eat. Well, yes, it's the global input that counts, of course. For been in Nigeria, you see some beautiful women who don't drink in this terrible climate at 45 degrees. How do they do it? They almost don't drink, and they look so good. Well, something happens in these populations that have limited access to water. It's an ancestral habit. They drink very little. And if I push the paradox, I'd say that they're wonderful when they are 25 and 30, but not later. Tell us a bit about what we can do to recycle waste, Jean-Louis, and what can we do with water? Well, that's a question I didn't really expect, actually. With waste, you can't make water. I think in reality that you've got to reason in the following terms. waste is a source of energy or raw materials when it's recycled, or secondary raw materials. And I think that the world that we're in today is a world in which we're going to have to work on what we call the circular economy. That is to say, an economy that is much more economic of raw materials, and in water in particular, because today our economy is globally based on wasting raw materials. And if you take a look at the economy lectures we're given, we're told about work and capital, but we're never told about raw materials. And in the world of the future, we're going to have to give materials a certain value, which is what makes the 21st century so interesting. And the balance of the 20th century just doesn't apply anymore. Monique. Well, I'd just like to chip in for the purposes of the discussion on the way that we listen to our bodies, which is something I buy into. Our behavior is a behavior which over the centuries, in terms of our diet at any rate, has changed a lot. 10,000 or 20,000 or 30,000 years ago, we were hunters, and we picked fruit more than we hunted, in actual fact. And our diet was very rich in potassium, practically no sodium. And there were no measures of arterial pressure at the time, but I think one can imagine that the prevalence with arterial hypertension was almost nothing. And then we went through the revolution in which we started preserving food, making salted food. And now we have our modern food, which is exactly the opposite. That's to say, very rich in sodium, very poor in potassium. And of course, we've seen a lot of cardiovascular diseases occurring with arterial hypertension. And I'd just like to say that water plays a very complicated game with sodium, salt. And when we have more salt stocked in our bodies, our water balance changes completely. So you can't really trust the calculations you make. You've got to be very vigilant with this water balance and the deleterious effect that too much water can play, just like too much salt or stearine. But I'm really struck to see what extent, including in our pharmacopoeia, that we've looked at the excess sodium we take in and the drugs that are involved in angiotensin and so on. But the modulation of our water balance was considered as uninteresting to the pharmaceutical industry until recently, when they started manufacturing agonists of the antagonists of the receptor. And I'm 150% in agreement with you that we should try and improve this balance by natural means like drinking water rather than pharmaceutically. Monique. Well, I think Mr. Chussin's conclusion was perfect. In actual fact, the 21st century is something we're going to think about very differently. It's a total change from the 20th century, and our behavior in terms of our food and what we choose to eat and our environment are things we're going to have to think about far more and in more global terms in relation to these major inequalities. Jean-Louis Chaussin, are you still there? Good. Well, you're a happy man then. You're president of Suez Environment. Can I buy your shares? You've got the future before you. Well, I can't recommend anything in particular. But if you have to make a choice, Suez Environment is not going to be the worst at all. And on a more serious note, I do share the previous conclusion that was made, because the 21st century is going to be far better balanced, and the inequalities of the 20th century certainly aren't going to be able to last into the 21st century, especially in terms of raw materials, of which water is one of the essential items. And then you've got agricultural materials as well. Right. Well, we've got to create a ministry that covers the food business, the environment, and health. Well, I think Ségolène Royal actually thought about that, and I'm sure the industry will be in agreement. Right. Well, thank you all very much indeed, all three of you.